Welcome, Mobility Simplified for Weightlifters Nation. So excited to have you here. We're going to have an exciting, awesome topic. We're going to be talking about the best position to be in if you're currently dealing with back pain. My name is Dr. Corey Hoffner. I'm a doctor of physical therapy as well as a strength and conditioning coach. And I have my own business where we work and help people simplify mobility and reduce pain, all from home or their CrossFit box or their local gyms. So if you're interested in that and you need some help, you're dealing with pain, you want to improve your mobility, you want to improve your strength, stay on the call, stay on the video for tonight, and we'll kind of give you more information at the end of the call. So we're going to go over 5 points in detail tonight. Okay, 5 main things about the best position, and I'll give you the best position at the end of the call. So stay tuned for that as well. Okay, number 1 is lumbar flexion versus lumbar extension. What is lumbar flexion? We'll start with that. Lumbar flexion is literally just the position of your spine when it's flexed forward, meaning it's like a curve, right? It's like a C curve sometimes. So if you go down, someone says you're doing an assessment, they say go down, bend your bend your knee, keep your legs straight, but try and bend over and touch your toes, right? That's lumbar flexion. So your spine is naturally kind of curving over, right? This is thoracic flexion of the mid back, right? Lumbar flexion would be your lower back, kind of rounding, like if you did a cat and cow exercise. It's kind of like the cow portion of it, right? Or the camel, they call it, where you have a big hump on your back. That is a simple way to put it. And what's happening is when you go into flexion, it's opening up the space between your vertebrae, those little kind of spinal bones that make up your actual spine, right? So when you flex forward, it's opening that area. So if you have something called stenosis, which is narrowing of the spinal canal on the sides of the vertebrae, it'll help you to spend more time in a flex position, or you have really severe arthritis or some kind of like disc issue sometimes if you're older. Typically, if you're like 65 or older, you have more arthritic symptoms, more clicking, more cracking with movement. So usually you benefit more of a flexed position. And that could mean you laying on your back with your feet up or your knees bent, because it's going to take pressure off of your spine. It's going to kind of tuck your tail more underneath your pelvis. And again, it just puts you more flex, opens things up. You can kind of lay on the couch, right? You can slump down a little bit like this. That might even help you too to open up your spine. All right, we're going to talk about like how much time you should spend in this position versus the other. That's lumbar flexion. So hopefully that makes sense. If it doesn't, comment down below, let me know, and I'll give you more details on that. Lumbar extension is the opposite, right? If you want to promote lumbar extension in your spine, you want to be sitting towards the edge of your chair, right? So lumbar extension, you'd be sitting on the edge and you would be nice and upright, head looking forward, super upright, so to speak. And lumbar extension is going to actually close the space between your vertebrae. So if it looks like this, when you go into extension, which just means straight back or kind of over here, which is like kind of overpressure, or excessive extension, you kind of close the space a little bit between the vertebrae, so they become closer knit together. And extension is actually interesting because it helps a lot of people, younger people mainly, males and females, typically from the age range of 17 or 18 to about usually like 40 to 50, right? Because it helps them if they have like a disc herniation. There's a good chance by you doing extension-based exercises that disc can pop back into place. It's like jelly coming out of a jelly donut. The jelly can be sucked back into the donut, which would be the disc in this place, in the spine. And then you can lose that pain that's kind of coming from pushing of the kind of jelly on that nerve. So that's extension, right? Which one is better? It really depends on your body and what's going on in your spine. Some people should spend more time in a flex position, right? Where they're a little more forward, right? Which opens up the spine. And again, that's the older people typically who have stenosis, arthritic symptoms, who have a lot of pain with standing up for long periods or walking. And then some people should spend more time in the opposite position in extension, walking more, standing more, sitting less. And again, that's younger people typically who have like a disc herniation, disc bulge, etc. And these are just simple examples. There are other things, guys. I'm not going to tell you every single little thing, but hopefully that breaks it down for you. That's number 1, flexion versus extension. Number 2 goes hand in hand, sitting versus standing. Same thing. Should you sit more or should you stand more? Honestly, if I'm going to give you the answer to that, you should spend more time in the positions that feel better to you, okay? So if sitting feels good for your spine, spend more time in sitting. If standing feels good for your spine, spend more time in standing. It's that simple, right? You need to spend more time in those positions that feel like pain alleviating for your body. Okay, and it is ideal based on recent studies that they've come out with to change positions as frequently as you can. I don't mean every 10 minutes, that's a little bit overboard. I mean every like hour to 2 hours, right? If you change positions every 60 to 120 minutes, your spine's gonna feel a lot better because it's not gonna get stagnant, and it hates being stagnant. It's gonna get blood supply to it if you move, and it could mean simple things like literally just doing some twists back and forth, right? Maybe some openers, moving from sitting to a standing position, right? Anything really helps changing those positions. So that's sitting versus standing, right? Depends on you and your body where you feel better. If you feel better standing, right, or if you feel better sitting in a car, right, spend more time in those positions. Typically, like I said, standing for younger people, sitting for the older population, depending on what's going on in your spine. Number 3 is sleeping on your back versus sleeping on your stomach. This simulates the sitting and standing kind of debate, right? If you're sleeping on your stomach, you're going to promote more of an extension position of your spine. So it kind of simulates like sitting towards the edge of a chair, chest up. So sleeping on your stomach would be better for someone who has a disc issue, who's in that younger age group, right? Sleeping on your back with your legs elevated, it's going to be better for someone who benefits more from a sitting position, okay? The two go hand in hand. It's really that simple, right? The best position for you is the one that feels the best, okay? That is the answer for tonight's call. I could have opened it up with it, but that's just super simple, right? If I put that on there, no one would probably watch the video and they probably wouldn't believe me. But this is based on studies, based on my experience as being a PT the past 5 to 6 years, working with people both indirectly online, indirectly in person. All right, that's number 3. Number 4 is bed mobility. Why do I bring up bed mobility? Like typically people think bed mobility, like bed range of motion, like that's for like older people, like 80 and up. No, this is for all of you guys. As you get older, right, you can't just swing on a bed first thing in the morning, smash your alarm on your phone, right? Because you're going to hurt yourself typically. That's how most people get hurt, which sounds ridiculous. But think about it. If you're in one position for 7-8 hours over the course of a night, like you can't just get up and swing and twist your spine and put torque and torsion on it. It's just not going to go well. You're going to strain a muscle typically, or you're going to like cause a disc to herniate. That's actually happened to people in studies. They prove it, where they've gone up, flying up to get their alarm, which is across the room on the side of the bed, and they'll try and smash it, reaching across, or toss their sheets off this way. A lot of times their spine's kind of moving in weird positions. Their legs kind of stay on the bed, but their trunk tries to lead. And you can hurt yourself doing that. So, the benefit of, bed mobility is that you got to learn how to properly move with your hips, right? If you lead with your legs, if you bend both knees and you do a log roll, so your spine stays neutral as you change positions and your body moves as one segment, that's going to help you the most to not irritate your back and not kind of cause too much discomfort or anything like that. So that's number 4 for bed mobility. And number 5, right, is really just kind of what we talked about before, right? Same thing as before, right? Sitting versus standing. Could be sitting for the older people, like I mentioned, standing for some of the younger people. I don't know why I think that one I made the list twice for some reason. That's an error on my part. But yeah, so just to recap, right? We talk about lumbar flexion, which is kind of going forward, like you're bending down, touching your toes, right? Or if you're sink down your chair like this, that is also a form of lumbar flexion. We talked about lumbar extension, which is the opposite, where you're nice and upright, or lean back a little bit, standing or walking. Right, sitting versus standing, we talked about that twice actually. Right, so again, sitting could be beneficial for some, standing for others. So pick the positions that you feel the best in and spend more time in those. Sleeping on your back versus sleeping on your stomach, right? Same exact thing goes for that. Spend the time in the positions that feel the best to you. And guys, if you feel good sleeping on your back with your legs up, sleeping on your side with a pillow between your knees is very similar to that position. So sleeping on your side with a pillow is going to help you as well feel better, because it's going to open up your spine. And it's good too to change positions, like sleep on your left side for a little bit, switch to your right side, etc. Okay. Then number 4 and 5, right, bed mobility, just changing positions over time, super ideal, right? Trying to move the body as one segment, not twisting or torquing the spine too much, not rotating or extending back or flexing forward, kind of using the legs to guide you while keeping the core engaged, especially when you move from kind of that laying position to sitting on the edge. You squeeze your core and your glutes, it's going to help take some stress off of your back. And this is important if you're dealing with a lot of back pain or discomfort. So if you're really in that acute phase, anytime you get out of bed, it's going to hurt no matter what. Typically, if it's super acute and inflamed, it's going to cause a lot of pain to do any type of movement. So you got to try and use the muscles around your spine, activate them, and that's going to help take some strain off. All right. So that is it for tonight. 5 things, right? My fault. That's probably 4 things, but I screwed it up a little bit. So my apologies on that. I think I put sitting to standing twice, which I'm sorry about, but it's just that important, right? That's why we included it twice. If you guys are interested, you want to find out more information about me, what I do, or if you're interested in kind of working with us one-to-one, we do have a form. See if you qualify to work with us, just because we're very busy. We only take a few people based on if we truly think we can help you. Sometimes we'll have to refer you to someone in person. It just depends on where you're at in the stage of your injury, or if you want to just improve your mobility, we deal with that too. So definitely like and subscribe to the YouTube channel. Let us know if there's other topics you want to see. Be happy to address those in the next upcoming weeks. And if you have any questions, please link them down below. And thank you so much for tuning in. We'll see you next week.